the gaze. They stare, sometimes with sadness, pity, others with fear, revulsion, always with questions. How did this happen? Does it hurt? Is it getting better? Is it getting worse? And most importantly, can this happen to me or anyone that I care about? They want the story. So here's my story. It's told with my pictures. 1985, Sanford, Maine. In one of my earliest memories, I am getting out of the car to go shopping with my mom at Kmart, and I am so excited because it is the only store with toys within 40 minutes of my house. I stand peeling my legs from the vinyl front seat. It's summer, and it's hot. And if our car ever had air conditioning, it doesn't anymore. Today, I feel proud of how I look. I'm not wearing my usual androgynous overalls that dominated my childhood wardrobe because my mom thought their undefined waist and baggy fit concealed my irregular gait. But it's too hot for them. And so I'm wearing little white shorts with bows on the side and a pink Minnie Mouse tank top that my aunt bought me. My hair is swept up in pink elastic bands. I feel pretty, airy, so I'm walking a bit straighter, more confident than usual. Out of the corner of my eye, I see a little girl and her mom. They're staring at me. My face gets hot. The little girl whispers something. The mom says, "Shh, don't look at her." She can't help how she looks. I'm close enough to the store that I can see my reflection in the glass door. My body is thin and muscular and tan from hours of swimming in the river behind my house. I see my deep-set, dark eyes, my average, nondescript Lafredo nose that my father says is preferable to both the Tomasi and the Malio noses of this family. My dark brown hair reflects the sun. I also see what that mother and her daughter see. I'm hunched forward to balance on turned-in feet. Purple scars snake up my calves. It's at this moment that I realize the operation didn't fix me. The doctors slicing into my calves, snipping my tendons to manually lengthen them and then stitch them back together, did drop my heels to the floor. I'm no longer up on my toes, and I don't need those white clunky braces or the socks that reduce the chafing. I was so excited to be rid of them. It's only now that I know that the operation, followed by full leg casts, followed by walking casts, followed by months of physical therapy, haven't changed how I look enough for anyone to notice my cute outfit before my gait. I'm 4, and I'm so aware of my body, how it feels to live my identity through it, how culture responds to it. I'm just so very, very aware. Storytelling, it's visceral. We feel a moment with a stab, a sink, a swell, a flutter, a punch. We section it off to remember through the embodied telling and the retelling. 1992, Boston, Massachusetts. I'm screaming, hysterical, tied down with nylon bands. The nylon bands are soft, but they're strong. I can't stretch beyond their 3-inch length. Yesterday, the doctors performed a bone rotation. They sliced into both thighs, peeling back the skin and prying the muscles to the side to reach the femur bones, which they sawed in half, rotated 30 degrees, and nailed back together again. The last thing I remember is the strawberries. They told me I could choose bananas, blueberries, or strawberries, and I chose strawberries. And I breathed deeply, and I counted backwards. 25, 24, 23, and I was happy. This was the operation that was gonna fix me. I was gonna be normal. Sometime during the night, the epidural that was numbing the pain, it fell out. Blood pooled behind me, but the nurses thought that I had just started my period from the stress of the surgery. So they just put towels back there and felt that they would change the bed once I woke up. By the time they realized, the blood was coming from my back, not from between my legs. The painkillers had worn off. I'm 12 and I'm small for my age, and to go back up to the required amount of painkillers would cause my body to go into shock. So instead, they tie me down so that I can ride the pain with my legs in traction until multiple lesser painkillers can take effect. Normally, I don't even notice that my body is constantly spasming. My brain sends signals to tighten again and again and again, and I don't notice, well, until the pain pools in my toes and sloshes up my calves. But right now, with both of my legs sawed in half, every involuntary movement is excruciating. A woman comes into the room. She has a series of pictures of faces. She wants me to choose which one is my pain level. There's one smiling, all the way one with its mouth open that's crying. She had talked my mom and dad into having me participate in this study on kids in pain after surgery. I can't, though. It hurts too much. I can't pick one. My brother's staying with me. Well, until my parents get back from lunch. He tries to help. I think it's that one. He points to the one that has a face with its mouth open and crying, the one that looks like me. You can't choose. We can't count her in the study unless she chooses. I finally fall asleep, a mixture of exhaustion and the lesser painkillers finally taken effect. As I tell that story, my toes curl. My body remembers. It was the worst pain I've ever felt. Storytelling is collaborative. Tellers and audiences working together, switching roles, moving back and forth in this messy meaning making. The story continues. 2013, Wilmington, North Carolina. I arrived at the hospital about 2 hours ago. Before that, I woke up my husband, Evan, because that dull pain in my back had increased in intensity enough that it was time to cradle our sleepy toddler to the car and drop him off at a friend's house before heading to the hospital. This is my second baby, and I deliver quickly, so quickly that I don't believe in having any kind of painkiller during childbirth. I actually find the break that I get between contractions to make overall labor pains pretty manageable. Well, a lot more manageable than that operation I had when I was 12. Besides, I don't believe in epidurals. They fall out. It took about 5 minutes for me to finally agree to the nurse inserting this IV into my wrist. It burns, even though she says it doesn't. It's no use arguing. It's procedure. I'll get them to take it out once Vinny gets here. We enter the dimly lit delivery room, and I see the labor tub filling in the corner. I wonder if I'll get to use it. This hospital only allows water labors, not water births. And I have a feeling that Vinny is coming soon. Too soon for me to get into that tub. I'm right. I feel a warm stream of water going down my leg. My water broke. Call the nurse. I will. Evan hits the intercom. It awakes with static. Her water just broke. We think it's time. All right, we're on our way. She doesn't sound very excited. Childbirth probably isn't that exciting when it happens 5 times a shift. That's all right, because I'm excited enough for the both of us. It's been an uncomfortable pregnancy. I'm ready to meet Vinny. The nurse comes in. She's about 25, with tired eyes and a drawn face. She looks between my legs. Yeah, you're definitely ready. His head is right there. You are gonna love his hair. It's dark and thick, a lot of it, just like yours. I smile. You know, she sees a lot of babies, but not all of them have hair like mine. The doctor comes in, and she's followed by another nurse. This is my least favorite doctor in the practice. She never listens to any of my questions during appointments. She just says, you've got the blood pressure of an athlete, and the baby's moving fine. There's nothing to worry about. Still, I'm not all that upset that it's her who's on duty. After all, it's not like natural childbirth leaves a lot of time for conversation anyway. Okay, I'm gonna need you to scoot down to the edge of the bed, and I need you on your back, and you need to open your legs wider. I can't open my legs any wider than this. This is as wide as they go. I have cerebral palsy. I wasn't expecting to have this conversation. Dr. Novosel, the doctor who delivered my first baby, Tony, she said that she can catch a baby from any angle to just get comfortable. This doctor, who shall remain nameless, seems more about procedure. And I make a mental note that I'm gonna schedule my postpartum appointment with Dr. Novosel. A contraction comes and I get ready to pull her legs apart. No, don't! My legs lock and spasm as the contraction hits, and I can't push. I can't scream. I can't even breathe. It hurts too much. You are never going to have a baby if you don't push when the contractions come. Well, if you keep holding my legs like that, I can't. I realize I'm not breathing, and I take a deep breath. Because my baby, my Vinny, he needs my air. I try to remember that this doctor is not a neurologist and she's not an orthopedic surgeon. She probably knows nothing about cerebral palsy. I think it's gonna be okay. The nurse's eyes went wide when my legs locked in that spasm. Another contraction comes, and another, and another. And Vinny's here. He's warm, wet, slippery. but I can't focus on him. I'm not finished yet. I feel the pressure as the doctor pulls the umbilical cord, releasing the placenta. It's warm, wet, squishy. I think I'm finished. With Tony, once I delivered the placenta, I was finished. Can you please hold her legs apart well this time so that I can put a few stitches in? No, don't! The nurses brace for the spasm in my legs, and the pain mixes with the sting of her needle and the dull ache of my organs going back into place after delivering 7 pounds, 8 ounces of baby and the placenta that nourished him until now. Vinny's crying, but I can't comfort him. I'm still inside my body. He's not quite in this story yet. Storytelling is susceptible, forever open to change. All that we do can be undone and redone. There's hope in the revisions. 1994, Wells, Maine. I just arrived at high school. This high school is made up of 3 towns, and mine's the smallest and furthest away. I'm only 13 because when I was in 1st grade, my teacher, Mrs. Pedagogy, she thought that my handwriting was weird. She thought I walked weird, I looked weird. She just thought I was weird. So she sent me to the special needs room, where they ended up just putting me in the corner to do my work by myself for hours a day, because my learning needs just aren't that special. I ended up a whole grade ahead. And in my small K-8 school, at the end of 7th grade, they said I was ready for high school. So here I am, a whole year early. A mixture of physical and water therapy have me walking with my back straight and my feet facing forward. I still limp. My knees and my ankles are still kind of stiff, but my scars are hidden under my brand new flared jeans. Out of the corner of my eye, I see a group of boys. They're nudging each other and laughing. It's like the Kmart parking lot all over again. This operation didn't work either. One of them's coming over. He's smiling. He has black, wavy hair and blue eyes. He smells like a mixture of laundry detergent and cigarettes. I decide I don't mind the combination. Hey, I'm Shane. You're new. My name's Julianne. I'm from Acton. There's not many of us.
Well, Julianne from Acton, where are you going?
My first class is freshman literature.
Well, you are in luck because I know right where that is and I am going to show you. Come on. Did you hurt yourself? Practice? Did you pull a muscle?
No. I don't practice anything. I do physical therapy. I have cerebral palsy. It's a muscle disorder. Makes me walk weird.
Not that weird. I just thought you hurt yourself. Playing a sport or working out. You look like you work out. You look great, by the way.
Thanks.
Come on. I'll show you where that classroom is.
Okay. Shane was my first boyfriend. It didn't last long, but it marked a change to my story. You see, after that bone rotation, once I healed, even though I still limped, to the untrained eye, it looked like maybe I had pulled a muscle or sprained an ankle, that maybe I was gonna get better. And even when people found out that wasn't the case, they still wanted to be my friend. They wanted to get to know me. They wanted to date me. I discovered theater. I found out I love the stage.
The stage.
When I first did this performance, people came up to me afterwards asking me if I would move more. My limping, gimping body up here on this stage, resurrecting a politically correct freak show. It made me uncomfortable. But all right, I'll walk. And you can watch. But also listen. Because my body, it has a message for yours. 2007, Honeybrook, Pennsylvania. I just finished Thanksgiving dinner at an assisted living facility. Evan is my fiance. He's been my fiance for a little over a month. His grandma Mary is holding onto his arm, and his sister Rachel is a few feet ahead of us. The dinner was way better than I thought it would be. The turkey, the mashed potatoes, the vegetables, the pie. The room's prettier than I anticipated, with plush patterned carpets and vaulted ceilings with chandeliers. As we get to the entrance, Mary lets go of Evan to grab onto her walker with oxygen tank attached. Mary is thick and broad with a raspy voice from years of smoking, followed by emphysema. Let's go back up to my apartment. We follow Mary, leaving behind the sign that says no wheelchairs or walkers in the dining room. As we get off the elevator, Evan and I hang back a bit, and I watch Mary and Rachel walk a bit ahead of us. This is my first time meeting Grandma Mary. Evan warned me that unlike his no-nonsense farm family from Kansas, Mary cares deeply about appearance. So I dressed up beyond the flannel and jeans I would have worn to my sister's farmhouse in Maine. I have on a chocolate cashmere sweater and a camel pencil skirt and knee-high boots with pointed toes. They hurt. My feet can't spasm without scraping up against the stiff leather, but they look so good with this skirt. My hair's blown dry in waves. I have on more makeup than usual. Seeing Mary seems to verify Evan's assessment. Her perfectly set, dyed brown curls, her silk blouse with tweed blazer and brooch with jewels. Evan, do you think Mary likes me? I'm having trouble reading her.
Of course Mary likes you. You complimented her department. You listened to all of her stories and asked great questions. She loves you, just like everyone loves you.
Well, from that, at least I know that you like me. Do you know why they don't allow any wheelchairs or walkers in the dining room?
Well, Mary will tell you, it's to keep all the old sick people out. But I like to think it's just so the waiters don't trip on them or something.
I hope that's it. I mean, bodies break down, and that shouldn't keep them out of beautiful places. I mean, especially in an assisted living facility.
Agreed.
As we get close to Mary's apartment, we can hear her and Rachel talking.
Is Evan worried about what people are gonna say when they see who he's marrying? Does he think it's gonna hurt his job prospects when people see that he's getting married to a cripple?
I don't think so, Grandma Mary. He's never mentioned it, and no one at the university has either.
Well, in this day and age, they don't mention it. They just think it.
Evan and I walk into Mary's apartment. She knows that we heard her, but she doesn't look apologetic or embarrassed. Rachel looks worried, though. She hasn't known me long. She's not sure what I'm gonna do. But I just smile. Mary's old, and she's sick, and she doesn't need to die in an argument with me on Thanksgiving about ableism. Ableism, the unabashed rejecting of my disabled body. Culture beams with pride as parents say, oh, you know we don't care. Well, as long as it's healthy. You mean as long as that baby's not me? It's okay to not want me. Ableism is pervasive, but it can be dismantled. 2012, Wilmington, North Carolina. It's been 2 years since Ev and I moved down the East Coast for me to take a job as an assistant professor at the University of North Carolina, Wilmington. And we've put off getting our in-state licenses until now. There were just so many changes in our lives. It was easier to leave my little white Nissan insured with my brother's insurance company back in Maine. But after all of these changes, new jobs, new state, new house, new baby, we need a new car. And the Gold RAV4 that we chose because it easily accommodates our growing family and big standard poodle on trips back to Maine and Kansas to visit family can't be tagged or insured unless we have in-state licenses. So we study for and pass the mandatory written exam. We pose for our license pictures, and as the man hands me my license, I think, oh, do you have that application for a handicap placard here? Do I get that here at this office, or do I need to go somewhere else?
What do you need it for?
I have cerebral palsy. I know sometimes people don't notice right away, but when my hands are full, I can trip when I'm walking, so I have a handicap placard so that I can park closer to places. That was way more information than he needed, but I always get nervous talking about my handicap placard, that people will hear my diagnosis and think I'm less capable than I am, or that they'll see me and think that I don't need a handicap placard at all, that I'm faking it.
Wait here. The man walks away. He's big, somber, graying. I suddenly feel smaller, younger, less capable than just moments before. I try to tell myself that the nerves are just because I'm tired. My 2-year-old is wriggling down my side. He has already been at the DMV way too long to find it interesting. My back is hurting. I'm pregnant. I want to get off my feet.
the man comes back.
We're gonna need to do a road test.
A road test?
It's procedure.
A road test is procedure for someone you just gave a license to?
Driving is a privilege, not a right, and we reserve the right to test disabled at any time. It's for safety reasons.
Okay. I make my way to his car for my driving test, and I am both angry and really, really nervous. I'm angry because I have to take a driving test, and Evan doesn't. Even though we have the same exact licenses from the same exact state.
I'm also nervous. What if I fail this test that I shouldn't have even had to take in the first place?
My entire body is shaking through the entire test. Has nothing to do with cerebral palsy. I'm just so angry and so nervous. But other than my really jerky 3-point turn, I pass. I'm relieved. Until 2 weeks later, a letter arrives from the state of North Carolina telling me that I need to travel 3 hours to take a combined physical and road test at a facility that won't take my medical insurance. It takes 2 hours to finally get somebody on the phone with the authority to move this new road test and physical to my local DMV and doctor. So I make an appointment with my physician. He's happy to see me. Most of his patients are elderly, but since his office is right by the university and we can usually get in the same day, Evan and I have him as our primary provider.
My assessment, you have better overall coordination, flexibility, and balance than I do. I feel safe with you on the road.
I head back to the DMV for my driving test. And I pass. Even my 3-point turn was perfect. 2 weeks later, another letter arrives from the state of North Carolina telling me I'm gonna need to travel to that facility for the combined physical and road test. The first person that answers the phone looks up my file. Well, according to this here, you have cerebral palsy, but it doesn't say anything about what they're gonna do to the car to make this safe for you to drive. There's nothing about handheld brakes or some sort of assistive equipment. I do have cerebral palsy, but I ski black diamonds, I road bike, I do yoga, and I do not need handheld brakes. I hang up the phone. I call a civil rights attorney. He writes a letter. 3 weeks later, I get another letter from the state of North Carolina, and my permanent license is enclosed. They let me know I will not be hearing from them again. I make jokes about the whole thing on Facebook, but really I'm sad and concerned for all the people that might not know that it's time to call an attorney or wouldn't have the ability to do that, even if they did know. Mortality. The inescapable reality of the flesh that we're in, all that we are, will continue to change. It'll break down, and we will disappear. '18. Wilmington, North Carolina. I'm walking through Target, as I usually do, my 2-year-old on one hip, my 6-month-old on the other hip, because neither of them will ride in the cart. My 5-year-old weighing me down, and my 7-year-old bumping into me every few feet. I stop at the after Christmas sales rack, and I look at each of my 4 boys, wondering if I can predict their size at about this time next year with enough accuracy to get an amazing deal on matching gingerbread t-shirts when I hear a voice. You know, you are never gonna heal if you don't put those boys down. I'm not hurt. I have cerebral palsy. Oh, well, I thought all these children were yours. They are. No, dear. I mean, I thought you gave birth to them. I did. Oh, well, are people like you usually fertile? Yeah, cerebral palsy doesn't impact fertility. But aren't you worried about leaving these poor, beautiful boys without a mother? Cerebral palsy also doesn't impact life expectancy. But just so you know, questioning a stranger you just met at the Christmas sales rack at Target about their choices in family planning and their impending mortality, it's a bit invasive. And she walked away. Marginalized. Some bodies exist on the slippery edge of culture, denied the opportunities that the dominant take for granted. You see, the powerful need the oppressed. Normal needs abnormal. The center needs the margin to exist. Without me, who are you? 2006, Orono, Maine. I just arrived at feminist theory. I'm a little bit late. The only seat left is next to the professor, Naomi. But that's fine, because I like Naomi. She's smart and thoughtful, and I also really like feminist theory. I look forward to it all week. Well, except this week. Every student in the class has to lead one of the seminar conversations, and this week is my turn. It's on the relationship between the women's rights movement and the disability rights movement. I didn't have to pick this week, but everybody thought I would, so I just did. Julianne, are you ready to start? Yes, Naomi, I am definitely ready. Thanks so much. Okay, everyone, before we begin this conversation, I think it's important that we understand how disabled people were viewed in society. Julianne? Yeah? Do you mean people with disabilities? No, Naomi, actually, I don't mean that. I really hate person-first language. I am a white woman, not a woman with whiteness. I am a straight woman, not a woman with straightness. I'm also a disabled woman. It's just another identity marker for me. And I think to change the rules of how we do adjectives in the English language to talk about just that aspect of my identity further stigmatizes and marginalizes it. How about differently abled? Would that work? Well, no, it wouldn't work for me. To say differently abled is rooted in this idea that we all have different abilities. And that is definitely true, but while race and disability have very, very different histories, to me, to say differently abled instead of disabled is like trying to make the argument that because the human race began in Africa, that we're all African, or because we all have pigment in our skin, we're all of color. And it's not that that isn't true, but it minimizes the reality of bodies marked as African or as Black. And so I just don't like the term differently abled. I just like the term disabled. Just so you know, you're getting kind of angry and defensive, and that's gonna make this conversation really hard. It's her. The one student in this class who always lets everybody know when how we are speaking could be making it difficult to have a conversation. And she says it whenever there is any sense of urgency in anyone's voice. And how are we going to dismantle oppressive systems without a little bit of urgency? You know, maybe if as a class, we were all a little bit more concerned about the cultural system that is making Julianne angry and defensive, instead of how the tone of her voice is making us feel, we could all collectively use this 3 hours that we're together every week to pursue a better world. Thanks, Paula. Paula is the only Black student in this class. And to my knowledge, I'm the only disabled student. And while she's not disabled and I'm not Black, we both know marginalization. We work to be the best allies we can. Allies, those of us committed to dismantling the oppressive structures that marginalize bodies in this culture. Even the structures that don't impact us. Even those structures that we personally benefit from. It's difficult, complicated, uncomfortable work. But I hope you'll join us because we're exhausted and we need you. 2020, Wilmington, North Carolina. I'm rocking Theo to sleep in front of the TV. He finally is out. We've been in COVID lockdown for a couple of months now, and without his brothers and Evan and I coming and going, he lost all sense of time. There was no schedule, so naps disappeared first, and then bedtime got later and later. I've stopped fighting it. I'm tired and I'm sore. He's heavy against my hips. My heel cords are tight. You see, normally, in a regular day, I would be moving as I lectured, moving as I directed. Now, I sit to record my lectures on Zoom. I sit to create and grade assignments, and there's so many more assignments to create and grade in online learning. My body is so stiff and so sore. I look over at Evan. He's on the love seat. He has his legs draped over one of the arms. And I think back to when we got that love seat right after we were married, when there were just two of us and 2 cushions were plenty. How are you doing?
I'm sore.
Yeah, I know. Evan is a lot like his dad. He has his dad's same broad shoulders, his dad's same kind, patient, sensitive, empathetic disposition. He also has his dad's back. When Evan's dad was about his age, he had to give up industrial farming and go back to school to become a high school teacher because of a back injury. I noticed a few nights ago when Evan reached for the spaghetti seasoning that we add to our pizza crust that he winced. Evan has his dad's back. I really think you should go to the doctor and get it checked out.
You know I will. I'm just gonna wait a little bit. Maybe cases will go down. There's no use risking exposure if we don't have to.
I guess so. I try to stand up with Theo in my arms. Normally, I'd ask Evan to take him to bed, but he's as sore as I am. I stumble, and Theo's eyes go wide and he grabs on tight. So I sit back down and I rock. And I turn on another episode of This Is Us. And I wonder, with 2 disabled bodies in this house, who's going to shoulder the load? As I told that last story, I wonder if you felt nervous for Evan and I. Know that Evan and I aren't nervous, just thoughtful and planning. Because Evan, because he lives with me, and me, because people have been drawing attention to the vulnerability and mortality of my body for as long as I can remember, have become what I like to call hyper-embodied. And that term hyper-embodied has some negative connotations for some people. They hear it and they think of someone with anorexia, obsessed with every calorie and pound. They think of a bodybuilder completely consumed with ideal chemistry and ideal symmetry. They think of a doctor so hyper-focused on diagnosing a patient that they've lost the person. But I disagree. To be hyper-embodied is to be at ease with the inescapable mortality and the fact that our bodies will change over time, so that we plan for it. And if we could all become hyper-embodied, we could build a culture that flexes and changes with our bodies so that we're all valued and included for as long as we're here. And in that hyper-embodied culture, perhaps the fear surrounding mortality could disappear, so it didn't have to be piled onto the shoulders of disabled bodies like mine. Hyper-embodied, too fixated, too obsessed, too focused. Well, that's all nonsense. I'm enlightened. You can be too. Thank you. And please stay for a conversation after the show. I'd love to talk to you and get your thoughts.
Fantastic.
Oh, thank you.
Just beautiful. God, where do I start? It's just so many moments. That text is just so rich, so beautiful. Thank you, thank you, thank you.
Oh my goodness, thank you. That's so encouraging. I'm so glad you're here.
Yes, Julianne, you're going to have to just give us a few seconds to just think thank you thoughts, because that's really where we're at right now. We're so pleased to have been witness to this before we can put our asking question hats on. It was absolutely lovely, provoking, evocative.
Thank you. Well, thank you for the invitation to do this. And I know we can't all be in a shared space, so I'm glad we can at least be in this shared space now.
What a great production team you have working with you.
Thank you so much. David Purnell and Robert Siegel are our video staff here for our video sequence. And they were able to come in on Saturday to make all of this happen, along with my director, Frank Trimble, who's also my beloved colleague, and my husband, Evan, who helps make sure the backdrop for the show is all running well. So none of them want to be on camera, but they're all here.
They leave that up to you.
They do.
Julianne, your work is so powerful and moving and evocative. I feel fortunate to have seen it again, and I just really want to congratulate you. I think it's so, there are so many layers to it. It's like Tammy was saying, right? We need time to kind of work through that, but I just want to congratulate you and celebrate you for the beautiful performance that you've shared with us. Thank you.
Oh, thank you so much. And there's a lot of comments coming up, and I can't quite see the comments. I'm a little too far, so I'm going to move a little bit in so that I can read. I've got pretty good eyes, but I needed to look a little bit more. Okay.
Hey, Julianne, it's Stacy and Anne from Melbourne. Just want to say
Hi.
lots of love and thank you so much for that amazing performance. It was spectacular, as all your work always is. Thank you.
Well, thank you for being the editor of the book that began it. So much of this is made from the book from Dan's series that I have, Embodied Performance is Applied Research, Art and Pedagogy. It's taken from different chapters of that book. So.
That award-winning book, let's say.
Yes, thank you.
Congratulations on that as well. Thank you so much.
Julianne, it's very generous of you to give us this time. Is there, especially right after performance, which is always space, is there some particular points, ideas about your process? Because I know we'd all like to hear about that, that you find particularly important or provocative, or that you would like to mention?
Sure. One thing that I very much struggle with as a performance artist is I want to still be a professor. I want to teach during the performance, and I want to help people unpack what's happening. And in the first round of the script, Frank looked at the script and gently told me that you need to take the lecture out you can't debrief every scene like you're wanting to. You've got to not do that. And instead, I decided, well, I created the small little snippets of vocabulary that I said, well, I need people to maybe just be thinking about this word and what this word means. And if it's under 30 seconds as a shifting point between the scenes, I felt that helped me manage that desire to define and teach that is just sort of in my DNA and that I want to put into every time I perform. So I was glad to have that piece there because I just wanted it so much to be able to have people thinking about what these terms that I was using and what they mean and what storytelling is. So I think that's one thing that is a lot of the struggle for this script was figuring that out, and also hoping people wouldn't mind that it goes by theme instead of chronological order. Because in so many ways, like, it's so many. So I wanted that. It didn't flow as well for me if I just sort of grew up. There was just scenes that kind of needed to be together, even though chronologically they were very far apart. So those are kind of the things I struggled with.
Julie, this is Anna. I have a question about the title. It was very powerful, and when I read My Mortal Body, I wanted to know if there was a relationship with the fragility of life and that idea of COVID, if that played a role in the titling, and how did it play for you during these times, and thinking about how fragile we all are, and our bodies are so susceptible to all that. Thank you.
Oh, well, thank you. Well, the show has been called Gazed At pre-COVID. In fact, I was hoping to tour it, and then COVID hit. It took me how many years into my career to finally do a one-person show, and then COVID hit. So the performances had to be virtual. But I did want, and that's really, the book that I wrote really makes the argument throughout that I think the stigma that comes to my disabled body comes from people wanting to throw their mortality onto my shoulders, onto my body, and think of me as fragile, think of me as dying, even though cerebral palsy doesn't even shorten my lifespan in any way, that they want to do that. And I think that I am at ease with the fact that my body is inevitably going to change with age and illness and injury in ways that other people are afraid of, because my mortality is always in conversation, from the person at Target to the doctor assuring my mother that I wasn't going to die very quickly. Like, that was always what people wanted to talk about. And so I believe that if we all become hyper-embodied and get at ease in this idea that these inevitably changing bodies are going to die, but they're going to change a lot before we die, unless there's something, a really abrupt change, like a bus or something like that comes along. So there is this idea that I hope that we can all get at ease with that, because then we wouldn't need to make bodies like mine shoulder all the mortality and move to the margins of society with that mortality. We could all be at ease together. But I do think that COVID, and that last scene was added right after COVID hit, is when I ended up adding that scene for an international festival I did back in November. And I do think that it made all of us sort of more aware of our ability to die suddenly, and also this idea that you need to care for other people, right? That you need to wear a mask for other people, and we had this cultural struggle over it, over who was willing to be hyper-embodied and embrace mortality and who was not and was gonna get their picket sign for a haircut, right? So so I got to see it so much more vividly, but yet I had been seeing it all my life. It was suddenly more tangible. That was a very long answer to your question. Did that cover it?
Very beautifully, thank you.
Oh, I'm so glad. Thank you for that question, because yes, COVID has sort of just had hyper-embodiment and mortality on all of our minds, I think, a little bit more. Well, mortality, and I hope moving us all towards hyper-embodiment.
Yeah, that scene of the COVID was very powerful.
Thank you. And Evan has had his back looked at now, and they think it's going to be fine, in case everyone was wondering. Well, it doesn't look like there's, does anyone else have any more questions or comments? And if not, I don't know what time it is, but do we need to be wrapping up to get people to the next session?
Oh, why don't you just give us just a couple more minutes?
Oh, okay.
I think that there are many things we'd like to say. Let's give ourselves just a couple more minutes.
Sure, yeah.
You've been so generous with your time.
Oh, I have nowhere else to be. I'm so happy you're all here and that this all worked out. I was nervous of how it would all go with the different time zones and everything, and would we all get here, but here we are. We made it.
And I might be speaking out of turn here. Maybe do other sessions begin at 6 Central Time?
I don't know. I don't know how late it goes.
Well, more importantly than that, do we have another question or comment?
Yeah, I just want to say that I was so moved throughout the performance and the way you wove your narrative with the visuals too. So did you create those visuals as well, the artwork?
The artwork is a joint creation between my husband and I. Evan, can you come out? They want to talk about your artwork. They do. So Evan and I, this show began when I was invited to be an artist in residence at the Southern Illinois University at Carbondale. And when I told the professor inviting me that I didn't have a show, he said, "Well, you have a book." He goes, "Just make a show from that." And I said, "Okay." And so I came. And so we worked together, Evan and I, of picking photos that evoked the stories from the performance and to see how we could manipulate them with digital art in order to make a show. And then I read the pieces in between to my 4 little boys. And so they would draw pictures of what they felt that particular piece was about. And so that's how we got all the pictures. So they're all made by my kids at different stages, because they made the first rounds of them in 2017, and they've been making different renditions throughout the time. So it's a combination of me, my husband, and really it's a family affair because my boys' artwork are in it as well.
Yeah, that's a creative family doing this together, and it just blended seamlessly.
Oh, thank you.
And then it kept the mood exactly right. Like I couldn't even move away from the computer, like nothing. Like I was just riveted to your performance. And then, yeah, like I fell through a range of emotion. I'm so glad Tammy asked us to linger longer because, yeah, I don't even know what to articulate because it hits you viscerally and you are so moved. And the microaggressions that you face day in and day out, you know, as a person of color, I have faced that myself, but then to see you and many of your experiences in similar places I also faced as a person of color. You know, at the DMV, them thinking that I don't know English, I couldn't articulate the make of the car. So I can put myself in your shoes and see exactly the places where people would hit you with roadblocks because of who you are.
Thank you so much for sharing that. And I found that throughout time that oftentimes, well, like Paula, in my feminist theory class, being the only one who really got it because she wasn't disabled, but she had lived marginalization and she had lived tone policing. And so she was able to move through that space in ways that my white, wonderful professor, Naomi, who was deeply committed to social justice, just wasn't ready to navigate at that moment. So I do think there is an allyship that's really there. Yeah. Thank you.
Did you direct this with him, like co-directed with Frank? So you realize when to cut to your face and when you show the full. Well, so do you write that as part of your script or how does that work?
No, I just have, David, can you come out, or do you need to stay at the camera?
I'm sorry to pull all of you
I'm
in.
just gonna call David over, because no, all of that is just David and Robert, who's
Sit.
all of that is David. And then Robert out back just making decisions in the moment as they see it, of where the camera should be. And they've both seen this show because this is my second I did a virtual festival before I did this. So this is their second go round. But yeah, that's all just their artistic instinct of when to do. And they have multiple cameras set up, and then Robert's out back deciding as he's listening which camera he should put on the screen for you. So I couldn't do it without them.
Thank you so much. I'm really deeply indebted to your performance.
I'm so glad you're here, and that's so great to hear. Thank you to all of you for being here. I had this sort of sinking feeling of what if nobody shows up? So I'm so glad that you're all here.
Hi, Julie. I just wanted to thank you so much for your performance. It was, as everyone else has articulated, very, very moving. My area is special education and arts integration, and so this is near and dear to my heart to see you doing this performance. And I have an arts-based research project that I'm working through phases, and it's about women who are breast cancer thrivers and warriors, and the shame, and because it's not visibly seen, unlike other things that you can see something different. And so there's performance pieces in that. And so yours has been very inspirational and powerful. It takes a lot of courage, just to live your life with a disability, let alone to do a performance and put it out there for the world. So as we know, arts speaks so much more powerfully than words can ever. So I want to thank you immensely for your courage and your performance to do this, and hopefully change a lot of hearts and minds of others.
Oh, well, thank you. That's so encouraging. That's good to hear. It took me a long time. People asked me often as a performance studies professor, when was I going to do a one-person show? And it just took me a while to want to do it. I think because of the gaze of people are always wanting the story and having all these questions. And it took till I feel like I had my footing as a researcher and as a professor and as a performer that I was finally ready to tell the story. It took a while. I'm sort of old to have my first one-woman show as a performance studies faculty, but I think because of the able gaze, it just took me a while before I was ready to do it.
I have one last question for you. Did you find it healing? Did you find by the performance piece, doing the actual performance, did you find that a sense of healing for yourself through that?
I don't know if it felt as healing, but I felt as though I was able to deeply connect and empathize with each character I performed. And as I entered their embodiment and how that interaction felt for me, even when they were an adversary, I was able to feel who they were, because in order to really perform someone, you have to feel what they're feeling. Mm-hmm. And so it helped me do that for a moment and see where they're coming from and hope for hyper-embodiment for them. Hope that they get there, that they don't need to, in ways that at the moment, I don't know if I was hoping for hyper-embodiment. I was very defensive. But I think in that way, so yes, I would say healing and connecting in a lot of ways.
Well, thank you again.
Yeah, thank you.
Julianne, I just wanted to quickly say, you said, gosh, I had to put the professor moments in between. The entire thing is pedagogical. The entire thing is teaching and learning par excellence. I continued to learn as performance assists us to do continually. I just really, really want you to know that.
That's so wonderful to hear. Thank you. I always get so nervous that when you give a story to people, how they'll fit it into the stories of their lives, and you just don't know. But I think it's true. Frank said to trust the story, to trust the characters, that they're accessible, they're real, and I think he was right. And it's been, like Frank's favorite character in the story is Shane. My momentary high school boyfriend. I think it was less than a month. Like, we really weren't together very long, but he made it into the show. And to sort of think about those kinds of connections that we're taught something about ourselves and that teach later. He gets a kick out of the fact that he's in it. We're friends on Facebook, so.
I was so nervous with that story, how he was going to treat you. And I felt such a warmth for him when that interaction went the way it went. Because I was worried about bullying and schools, and so I didn't want the story to go there in my own mind.
I know. Well, and I definitely, as a 13-year-old girl, like, I was definitely back in that Kmart parking lot, and there was no mom to stop him from coming over, and I was really worried. And you know, it ended up being a new beginning, a new storyline in my life. So I was, I'm always indebted to him for that in so many ways.
Julia, and there's a wonderful embodied testimony, and I think it's so resonant for so many of us. The way that you use your body to tell the story of your body, I think, is a wonderful coupling.
Oh, thank you. I always get nervous using my body on stage because I began my foray into acting in high school, and directors in high school and then in college, and I did a little bit of paid acting in Boston, not a lot of paid acting, but a little bit, and usually what they would always try to do is, how can we tell this story without you moving? Like, that was always what they were trying to do, is like, can we perform, because if you stand still, you're fine. So that was sort of, it took me a while, and I think it's why the first time I performed this show, I really didn't move. I just talked. And it's, I've become, I think, more at ease in my body throughout renditions. So thank you so much for saying that. I think getting that ease into our bodies is always, it just takes time. I think it's hard for everyone, but especially those of us that are navigating the gaze in that way. I'm so glad you're here, that you came again. I'm reading all of your comments. Thank you so much.
Anything else for Julianne? I know there's questions you are very much wanting to ask her. And of course, this isn't the only forum that she can engage with you.
Oh, of course not. You can always email me at scottj@uncw.edu. I'm also, my full name as it's there is on Facebook, and I don't see that as a protected place. You can always friend me on Facebook or Instagram as well. So I'd love to talk with you more. I know it can be a lot after watching a whole show and then having to talk about it right after. So if things come to anyone later, I'm always happy to keep engaging. It's a living show. If you liked it so much, if COVID restrictions ever lift, I do travel, and I would love to come and perform with you in your spaces. So. Thank you again for being here, and I hope everyone has a wonderful rest of the conference.
Thank you for your generosity.
Thank you so much.
Please join me in giving her one more virtual clap.
Oh, thank you so much, and I hope to see all of you more at different panels, at different times, at different conferences. And again, remember, if you need a performance artist, I am available. So I'll see you, hopefully see you soon. Bye.
Bye-bye, Julianne. Thank you.
Thank you so much.
Bye.